Hello all, welcome to the new initiative of Law Excellence IAS Academy. This is the new initiative where we give the gist of Kurukshetra monthly magazine. And now we are going to see here the gist of Kurukshetra November 2022. It focuses on the issue of science and technology. To your information, Kurukshetra is a vital source of study material for UPSC IAS examination. It is a monthly magazine that gives you information about government schemes and programs in various sectors. It is an authentic source of information for the UPSC exam, and it is very important to read this. Chapter 1, Technology and Innovation in Healthcare. To give a background, the global pandemic affected the whole world in 2020, and the necessity for robust Medicare management was intensified due to the COVID crisis. The pandemic also helped to realize the inadequacy of healthcare infrastructure in developing countries like India and globally. The vulnerabilities highlighted during the pandemic have led to the adoption of digital technologies to continue to provide the key healthcare services to the patients, especially those who could not visit the healthcare facilities physically for treatment. Technological progress and digitalization of healthcare. Healthcare is slowly shifting away from healthcare facilities, focusing primarily on patient home facilities, as the fear of COVID infection reduced the physical OPDs, and technology is driving this transition. Virtual counseling through telemedicine has received a much needed boost as teleconsultation has multiplied during the COVID pandemic. In 2020, the Ministry of Health and Family Welfare, that is MOHFW, Niti Aayog, and the Board of Governors, Medical Council of India, issued the telemedicine practice guidelines. This regulation has helped to democratize the provision of health services. It has also helped bridge the urban-rural healthcare gap. The Indian healthcare system has experienced a paradigm shift in ensuring the quality healthcare delivery to the citizens in the last 10 years, as technology has now been leveraged for better reach and patient care. The application of digital technologies such as artificial intelligence, machine learning, data analytics, Internet of Things, cloud computing, robotics is increasing in every facet of the healthcare system. Emergence of digital healthcare in India. Interoperability is the ability of systems to communicate with each other and make use of the information obtained through each other without any restrictions. However, the electronic health records, simply called EHR, of people are not easily available to the doctors, hospitals, pharmacies, etc. due to issues like security, permission and cost, which has affected the quality of healthcare available. In this context, the Ministry of Health and Family Welfare notified the EHR standards for India in September 2013 and revised EHR standards for India were notified in December 2016. Further, the review report by the Ministry of Electronics and Information Technology, MeitY, named Adoption of Electronic Health Records a roadmap for India, highlights the country's public healthcare facilities have very little ICT infrastructure such as computers and connectivity. In the wake of the COVID pandemic, the National Digital Health Mission NDHM Ayushman Bharat Digital Mission was launched in 2020, which is the implementation of the National Digital Health Blueprint prepared by the Ministry of Health and Family Welfare with an objective to create a framework for the national health stack proposed in 2018 by the Niti Aayog. NDHM aims to create a single repository of medical records of all the citizens. Under the mission, every Indian will get a unique health ID which will contain information about every test, disease, medicine and associated reports. A comprehensive EHR would be beneficial to the rural patients as it could soon include data from digital devices that display information about the patient's health problems and could include information about their lifestyle and habits. Scope of remote healthcare in India. India is a country with around 65% of the population residing in the rural areas. However, the access to timely and quality healthcare is lacking. One of the significant challenges faced by the rural communities is the lack of healthcare expertise. The most proven way to solve these challenges is to bring specialized training to the existing healthcare professionals. Virtual reality can be used in rural areas to assist healthcare professionals with training and experience through training simulations with a headset that places you in a natural healthcare environment. Virtual and tele-mentoring groups with experts will ensure that the training and support are continuous and ongoing. The existing health model has endless potential for inducing massive improvements, especially in the rural health sector, and revolutionizing the rural medical landscape. Also, it is to be noted that the purpose of incorporating technology into healthcare in rural areas is not to replace the doctors but to improve the efficiency of healthcare systems. The rise of digital healthcare facilities in India. The Internet of Medical Things is changing the nation's healthcare systems for the better. The IoT devices is the collection of medical devices and applications that connect to healthcare IT systems through online computer networks. IoT devices that are Bluetooth enabled can transmit all essential clinical data to the consulting physician in a real time, thereby mimicking the face-to-face consultation. McKinsey's latest report projects that telehealth will become a $250 billion industry post-COVID. The McKinsey's latest report projects, according to the report, the use of telehealth has increased 38-fold from the pre-COVID baseline. The industry is projected to reach US billion in India by 2025. Further, it has a broad reach in India's relatively untouched area. The Atal Innovation Mission AIM under the Niti Aayog has been promoting innovation and entrepreneurship in the country. The aim supports the establishment of new incubation centers called Atal Incubation Centers. Many startups and companies working on the healthcare related services and equipment are being supported by these Atal Incubation Centers. To conclude, an effective healthcare system of a nation is determined by its ability to deliver high quality and efficient care that is affordable and accessible for all. The access to quality health care has been a traditional problem in the country, especially in the hinterlands. However, government-led innovations are taking place at a rapid pace in the rural communities. As teleconsultation, e-pharmacy and remote monitoring have gained the trust of all stakeholders, more efforts have to be initiated to leverage other advanced technologies such as artificial intelligence, machine learning, and blockchain technology to enhance interoperability in healthcare, as they also help to create jobs and employment opportunities. Adopting an integrated approach for addressing both the public's health needs and investing in robust information and communications technology infrastructure is the way forward.